are 1 week into Dane County's mask mandate. Health officials say the rate of spread in Dane County is already going down.
So is there a big difference between the rate of spread in Dane County compared to other counties without a mask mandate? Dr. Zorba Pastor joins us to discuss that and other pandemic-related issues. Good to see you again, Zorba.
Good to see you guys.
So what's the message here? Masks work?
You bet. Masks work, social distancing works. When we look at the various counties in Wisconsin, the counties that have a mask, like this one, or any kind of other mask, any kind of mask you have, the rates are going down, the per capita rates are going down. In the areas where they're not wearing masks, the rates are going up. Now, you do the math. If they go up, there's more COVID, there's going to be more death and more problems. And if they go down, do what it says. You know, I think the people like who recently went to the rally today, you know, I don't want to wear a mask. Those are the same people who went to rallies. It's my right to smoke in a restaurant. You know, I can smoke wherever I want to. Remember, there were a whole bunch of people that said, don't get rid of smoking. I should be able to smoke. And the reality is eventually society said, no, you can't smoke here. It affects me. When you don't wear a mask, if you have COVID, it affects me. And I'll give you an example. I heard of a number of football players that were at a party. These are former Badger players. I have it on good source for this. And they were playing beer pong. And for any of our viewers that don't know what beer pong is, all they have to do is Google it. And it turned out one of them, they don't know which one had COVID. There were 20 guys at the party. They were all in their 30s. It turned out that about 10 of them, 12 of them got COVID. 5 of them got really sick. 1 ended up in the hospital. We've got to take it seriously, tamp down the curve until the immunization comes out, and then you can do whatever you want to.
Yeah, because cases are still on the rise. In Wisconsin, they went up 100,000 today, and we crossed that grim 4 million milestone in the U.S.
Absolutely terrible. Absolutely terrible. Now, in the immunization front, there actually is good news. There are a number of immunization candidates on the horizon, looking good. Pfizer is one of them, along with the federal government. We don't know exactly when it will be out. There still has to be something called phase 3 studies. There'll be big studies. I, for one, am going to volunteer for that. They'll measure antibodies, but right now it's looking very good. I think certainly next year by this time we will have an immunization, maybe a month or 2 before. But until you immunize millions and millions and millions of people, COVID is going to be here, and it's going to be here until we basically stop it in its tracks. And one of the ways to stop it right now is to wear this mask. It should not be a political issue. It shouldn't be any more than a political issue than washing your hands after you go to the toilet. You wash your hands so you don't infect other people. You no longer spit on the ground so you don't infect other people. You wear the mask so you don't cause me any trouble or cause somebody else who's even older than I am to die. Be a good citizen, wear a mask.
Wear a mask. 270-9933 is the number to call if you have a question for Zorba. 270-9933. We'll get to your calls right after this.